opening remarks, and it was chaired by Alhaji Hafiz Adam, the Chief Director of the Ministry of Health. And in his acceptance speech, he emphasized issues of collaboration, knowledge sharing, to drive innovation and efficiency in the supply chain practices, and also the need for us to give attention to the procurement infractions. In fact, he was not happy about the numbers that are going up and the need for us to see what we can do to improve that come 2024. And that we should all continue to ensure that we improve access to health commodities so that we can achieve the agenda that is the goal for the UHC. Okay, so DG's welcome address also highlighted on the need for strong leadership in order for us to achieve a resilient supply chain system, and that the public health sector we need to look at significant changes in the processes, procedures, technologies, and organizational culture. And also we should be thinking about alternative sources of financing so that we can cater for our financing gaps, because the external sources are dwindling, there's donor fatigue, and also we should be able to mobilize resources to finance all our supply chain interventions, and that we need uninterrupted access to health commodities for delivery of high quality services. Next slide. Next slide, please. All right, so the council chair also highlighted issues of how we can improve on the quality of our health services through the supply chain system. And in order for us to achieve UHC, we need to be able to address our supply chain issues, and also the need for us to build on partnerships so that we can strengthen our supply chain system, and for deeper collaboration to enable us to build a resilient supply chain system. All right, so we also had statements from our partners from Global Fund, the Public Procurement Authority. And for the Global Fund, they were looking at the issue of good leadership, partnerships over the years. They've injected so much resources into the health sector. But the question is, when they pull out, what happens? So we should continue thinking around the need for us to get other sources of funding for the health sector, and also for us to strengthen the supply chain system so that we can improve upon our performance. Then the financing issues are still critical when it comes to supply chain, as the Global Fund emphasized. So the PPA, they were looking at how we can continue to strengthen our procurement systems. They acknowledge that the health sector has done well over the years. It's one of the leading institutions in the public sector when it comes to procurement. But we still have a lot to do. There still has to be trainings on GANEP, and also the need for us to implement the provisions in the Procurement Act and all other related processes so that we can strengthen our system and improve on supply chain functionality. Next slide. All right, so Director SSDM took us through an update on the supply chain performance. And basically, she looked through the supply chain reforms, Gilmay's framework contracting, warehousing, the LMD interventions, and how they've contributed to strengthening the supply chain system. So there were issues about the impact of the interventions, how have they helped? And it was clear that we are seeing improvement when it comes to product availability. So the challenges of framework contracting were highlighted in terms of delays in payment, the economic conditions, and then the indebtedness to our RMS, and for us to how we owe vendors, leading to deliveries, delays in deliveries. The matters of warehousing, what has been done so far in terms of constructing a new central medical stores, which is still in the pipeline, and regional medical stores that were also renovated. FDA accreditations are ongoing, with the exception of 3 regions. It appears all the other regions have FDA accreditation. And the key challenges highlighted were inadequate storage capacities at the RMS, and then the issues of human resources still constitute an important matter when it comes to supply chain. Next slide. All right, so on GILMIS, we're told about almost all chip zones in the country hooked onto GILMIS. And then we looked at the impact of GILMIS on the supply chain system in terms of cost reduction, operational efficiencies, and all the rest. But the key challenges identified were the fact that the functions of GILMIS were not fully optimized. And then we needed to see how we can also bring on board interoperability systems to ensure that GILMIS is fully utilized, as well as staff motivation issues. So on governance, there were issues of the various structures that have been established from central to regional to facility levels, and then the regional supply chain coordinating committees or technical working groups that have been established. But there are issues with some of these committees because some are not fully functional, and also there's a need for us to get more funding to be able to implement many of these initiatives that are coming up in the supply chain area. We also need to ensure that the meetings are regular, and a major concern has to do with the fact that we don't have enough supply chain professionals. So we need more recruitment in that area for procurement and supply chain officers. Next slide. All right, so the Minister of Health, represented by the Deputy Minister, also took us through, gave us a number of messages ranging from the need for us to look at leadership towards the supply chain, and also for us to establish mechanisms to strengthen the health sector commodities. And the long-term commitment from government and PPP arrangements also need to be looked at, as well as putting together strategic plans to engage health partners for financing. Because what is in the public sector is dwindling, and then we need to work together to improve that. And the issues of continuous sharing of experiences to support the healthcare delivery system. And also for us to look at prioritizing internal customers so that we can see how we can improve on our relationship with our external customers. Next slide. All right, so GILMIS Utilization Awards. After all the formalities, we had these awards, which were basically looking at the KPIs, the key performance indicators for GILMIS was the main criteria for selecting the award winners. For the health sector category, we had a health center from Bono being on top, then followed by another from Western region and Eastern region. For the hospitals, Upper West Regional Hospital was adjudged the best countrywide, followed by Weoso and Community 22 Hospital in Greater Accra. The prizes were basically plaques and television sets for their award winners. So there were some key presentations and panel discussions. That was started by Dr. Adai Donko, who made a presentation on the theme, and he emphasized that a resilient supply system is one that is able to withstand shocks. Having gone through COVID, we should be able to build a system that can withstand future shocks, and we should be focusing on cost and efficiency of the supply chain system. And the no product, no program mantra came up just to emphasize the fact that without products or medicines, our programs cannot run. Leadership came up strongly as the cause for many of the interventions that we are seeing, and the need for us to emphasize, to build strong leadership. And also, we need to use the lessons that we've learned from the COVID-19 experience to be able to build a more resilient health system for future pandemics. He highlighted some challenges of the supply chain system, looking at cold chain management, the quality of the pharmaceutical products, expiries, prices, and all other related matters. So he ended by saying that we needed to have sustained political commitment, provision of human resources, and the support of partners so that we can build a very resilient supply chain system. Okay, so we also had a presentation from Dr. Adomako, who was sharing experiences in a new region in terms of supply chain and how he used his leadership abilities to mobilize his team and to be able to overcome challenges. From the famous El King Declaration, he took us through the background as to how he eventually was able to get his medical stores established, despite the fact that there are still challenges, but he was able to overcome using data and all other engagements he had with partners to be able to eventually get his medical stores in place. There are still some issues to be sorted out before it can be fully operationalized. But the lesson or the issues here were basically how leadership can drive change and bring innovations to strengthen the supply chain system. Next slide. All right, so there was a panel discussion on achieving sustainable financing for Ghana's public health supply chain for universal health coverage. So basically, the key issues that came up from the discussants from the NHIA, there were issues about funding, how we can get in more resources, ring fencing the sources of funds, the claims management, how we can properly get claims well managed, fraud issues, and the rest. And steps that can also be taken to ensure that the drug accounts, that is the monies that are channeled or paid from the NHIA, they are not paid into one account, but they are paid separately so that they can protect the drug account from abuse. Then from the MOH and the other partners, we're looking at how we can sustain collaboration with partners for resource mobilization, and also issues of transparency, accountability, our financial management systems, how we can strengthen or streamline the processes and deploy other tools. The aspect of the IGF guidelines was also discussed, how we can ensure that we enforce those guidelines so that our medicines and supplies are not depleted. And also how to mobilize resources to ensure that we think outside the box and don't rely on our routine sources so that we can manage the dwindling donor fatigue that we are experiencing. Next slide. All right, so there was a breakout session, and we went into two groups. The first group, we're looking at innovations in healthcare supply chain management, the GILMIS implementation, and also enhancing supply chain resilience. That was chaired by Dr. Winfredo Fosu. Then we came back to plenary. Yes, so during plenary, these were the key issues that were highlighted, and that we need to reform our supply chain system to ensure that the multiple systems are integrated to optimize their benefits. Can we get that started next year? Issues of interoperability. How does the GILMIS operate with other systems to reduce costs for us to be more efficient? And also all the softwares. It was noticed that the RMSs across the country, some have different softwares operating as standalones from the GILMIS. So how do we get that incorporated so that we can maximize the benefits? And also all the functions of GILMIS, especially the ones that have to do with consumption, have to be fully used so that we can have, or we can improve product availability and accountability. And generally, the issue of sustainability of the GILMIS operations post-partner support was critical. How do we get our systems to work when our partners withdraw funding in future? All right, so the other aspect had to do with the pharmaceutical traceability in Ghana. And the key issues were the fact that we have a lot of unregistered pharmaceutical products in the market, and that is very worrying. So we need to take steps. All stakeholders have to come on board so that we can sanitize the system and ensure that these products are properly registered for our own safety. Then the fake products also came up, and that we need to also get that dealt with. So FDA and all other agencies have to step up their game to ensure that we're able to weed out fake products. And also the pharmaceutical traceability strategic document that has been launched by the Ministry of Health, we have to get it rigorously enforced so that we can reap maximum benefits from it. Next slide. Yeah, so the second breakout session focused more on public-private partnerships and how our public health supply chain system is prepared for PPPs. That was chaired by Regional Director for Greater Accra. So the key issues from there, go ahead. Yeah, so the key issues from the PPP discussions were basically on how we can achieve efficiency in service delivery, how we can get more capital injected, capacity building issues, technologies and all that. And also we have to ensure that all partners or all parties keep to their assigned roles, responsibilities, so that we can better manage our PPPs. And the Gilmay's LMD interventions are examples of how PPPs have benefited the health sector. So how do we sustain that and bring on board others? And also the issue of getting more products onto the LMD system was also looked at, as well as accountability systems and visibility through performance-based payments are all controls when it comes to PPP. So we ended by, this particular discussion by emphasizing that the PPPs can be successful if we enforce existing legislative frameworks so that everyone benefits from it. Okay, I think that's fine. All right, so thank you very much.
Thank you. And I think you agree with me. This has been very comprehensive. We thank the rapporteurs for this update. Is there any burning issue that we want to add? Maybe one or two burning issues that were not captured? Okay, so there's no hand up. So we'll proceed with the second item on the agenda for the day. We are taking a presentation from the Director in charge of Procurement and Supply Chain of the Ministry of Health, in the person of Dr. Edward Bright Ejekum. He will be sharing with us the updates on the Supply Chain Master Plan 2021 to 2025 implementation and key next steps in the form of a programmatic supply chain update. Thank you. Let's give him a hand.
Good morning, directors. Good morning, colleagues. Once again, we are here by the mercies of God. My top management are not here because of the final funeral rite of the Mrs. Teresa Kufuor, which is currently ongoing at the International Conference Center. And that has taken the whole area. The traffic is not easy, so permit us. I stand here to give an update on the current Supply Chain Master Plan 2021